Welcome to the Medical Billing Blueprint podcast, where we break down the complexities of medical billing, revenue cycle management, and healthcare compliance. Join us as we explore strategies, tips, and industry insights to help doctors, practice managers, and medical staff optimize their billing processes and boost practice revenue. Let's get it right with the Billing Blueprint.
Hey everyone, and welcome back. So we're continuing our deep dive into the world of telehealth, and you guys know how much I love this stuff. This time, we're getting into the nitty-gritty of how these virtual visits actually get billed.
It's an area that often gets overlooked, but it's crucial to understanding the long-term sustainability of telehealth.
Totally. And I have to say, when I first started digging into this epicresearch.org study you sent over, I was surprised by how complicated it can be.
Oh, absolutely. There's a lot more to it than meets the eye.
Like, get this, the study found that telehealth visits often get coded differently than in-person visits.
And what's even more interesting is that it's not always in the way you might expect.
Right. You'd think telehealth being virtual and all would always mean lower costs, right?
It seems logical, but the reality is more nuanced. While it's true those telehealth visits often end up with lower billing codes, it's not always because they're less complex inherently.
Okay, so break it down for me. What's really going on with these billing codes?
Well, think about how telehealth is often used. A lot of it is for chronic disease management, like follow-up appointments, things like that. The study found, for instance, that about 60% of telehealth visits for diabetes management were coded as level 1 consultations, the most basic level. But for in-person visits for diabetes, only 30% were coded at that level.
So it's not that a telehealth visit for diabetes is somehow less valuable. It's just that telehealth tends to be used for a particular kind of visit within that specialty.
Precisely. Yeah. And that has a direct impact on the billing codes used. Now, here's where things get really interesting. The study actually found a surprising exception to this pattern.
Ooh, an exception. Tell me more.
New patient specialty visits. Sometimes those visits actually got higher billing codes when they were done via telehealth compared to in-person.
Whoa, really? That's unexpected. Why would that be?
It's still an area that needs more research, but one theory is that when someone has a complex medical issue, they might be more inclined to default to that in-person visit, especially for that initial consultation. And those in-person visits might involve additional tests or procedures, which would then bump up that complexity level and the billing code. So it could be that right now telehealth is being used for the more straightforward specialty consultations.
This is what I love about these deep dives. It's not just about the data itself, it's about the questions it makes us ask. So this billing quirk, are we saying it has these ripple effects beyond just the codes?
Absolutely. We're talking about real implications for both doctors and patients.
Let's start with the doctors. What are some of the challenges they're facing?
Well, for doctors, one of the big things is the potential impact on their revenue. If they're doing more telehealth visits and those visits are being coded at a lower rate, it can affect their bottom line.
And it's not just about the money, right? It probably impacts how doctors decide what services to even offer through telehealth versus in person.
Exactly. A doctor has to think, okay, if this type of visit is consistently coded lower via telehealth, can I afford to offer it that way?
It adds a whole new layer of complexity to their decision-making process.
Absolutely. And then for patients, this whole billing discrepancy can be so confusing. They might assume that telehealth is always going to be the cheaper option.
Because it's virtual, so it seems like it should be simpler, right?
But that's not always the case if those billing codes are different. And that can lead to these, well, surprise bills, which nobody wants.
Ugh, surprise medical bills talk about a way to erode trust.
No kidding. It really highlights how important that clear communication is between providers and patients. Transparency is key.
So what does that look like in practice? What can providers actually do?
Well, for starters, doctors need to be upfront with their patients. Explain how that telehealth billing works, what their insurance covers, and what those potential out-of-pocket costs might be.
Basically just being really upfront and transparent from the get-go.
Exactly. And then on the provider side, it often comes down to being really proactive and staying informed.
So give us the rundown. What are some tangible steps providers can take to navigate this whole billing maze?
Well, first and foremost, meticulous documentation is absolutely crucial. I mean, every single detail of that telehealth encounter needs to be recorded thoroughly.
So we're talking about the patient's history, what was discussed during the visit, the treatment plan, all of it.
All of it. Those comprehensive records are key to accurate coding and making sure they're getting reimbursed correctly. It's not enough to just deliver great care through telehealth. That paperwork has to reflect it perfectly.
It's like this whole other level of attention to detail that's required now.
Absolutely. And it's really a team effort. The whole healthcare team needs to be on the same page when it comes to telehealth billing, which means regular training and education.
Because the guidelines are constantly evolving, right? It seems like it'd be hard to keep up.
It definitely takes effort. And then regular audits of those billing practices are crucial.
Audits, so basically like a checks and balances system to catch any errors?
Precisely. Catch those discrepancies early on and correct them before they snowball into bigger problems that could lead to financial losses for the practice. Think about it. A doctor sees 20 patients a day, and let's say half of those are now telehealth visits coded at a lower rate.
That could really add up over time.
Exactly. If they're not coding accurately, it could translate to a significant loss in income.
Mm.
So staying on top of these billing nuances is almost a full-time job in itself,
Right.
but it's about ensuring that financial stability for providers, which ultimately benefits everyone.
Okay, so we've talked about the challenges, we've talked about some potential solutions, but I have to say, it still feels like we're in the early stages of figuring this whole thing out.
Oh, absolutely. This is still a relatively new frontier, and as telehealth continues to become more and more integrated into our healthcare system, we're going to need even more research on these billing discrepancies. This study is kind of like sending up a signal flare. Policymakers are definitely paying attention, and I think we can expect to see some movement on this in the coming years.
What kind of movement are we talking about here?
Well, it could be adjustments to the existing billing codes, or maybe even the creation of entirely new codes specifically designed for telehealth. Because right now, it does feel like we're trying to squeeze these virtual visits into a system that was really designed for in-person care.
And it's only going to get more complicated, right? I mean, telehealth isn't just about video calls anymore. We're talking remote monitoring, asynchronous communication, all sorts of things. The technology is evolving so rapidly. It makes you wonder if our current billing codes, I mean, they're so tied to the length of an appointment, how complex a procedure is. Are they really the right tools to measure the value of healthcare when we're talking about this digital age? What if we're like asking the wrong questions altogether?
You've hit on a really critical point. What if instead of focusing so much on the where of a medical visit and how long it takes, we really prioritize the outcome for the patient? Did they get what they needed from that interaction?
Right. Like, was their condition managed effectively? Did they feel heard, understood? Those are valuable aspects of healthcare, and those aren't always captured in a billing code.
Exactly.
Yeah.
And we are seeing a shift in some areas towards these value-based care models where providers are incentivized to keep patients healthy. It's not just about treating them when they're sick, and telehealth could be a really powerful tool in that transition.
It really feels like we're on the verge of something totally new in healthcare, and it's exciting, but also, kind of daunting.
For sure, the decisions that we're making now about how we pay for telehealth, how it fits into our healthcare system as a whole, these have implications for years to come.
Yeah, no pressure. Right. So for everyone listening out there, whether you're a healthcare provider, you're on the policy side, or you're just passionate about this stuff like me, here's a question to ponder. As technology changes how we experience healthcare, are we going to be bold enough to rethink how we actually value it?
It's a big question.
Can we create a system that truly puts patients first and gives them the power to get the care that they need when and where they need it?
Those are the questions that we have to keep asking. At the end of the day, it's not about the billing codes, it's not about the technology, it's about people's lives.
Couldn't have said it better myself. And on that note, we'll leave you all with those questions to ponder. It's been so fascinating diving deep into this world of telehealth billing. I can't wait to see what the future holds. Thanks for joining us.